Kansas is last in the nation for testing, but some good news, restrictions on testing are loosening in a handful of counties. When will the rest of the state catch up? And churches sue over the stay-at-home order. Is it violating Kansans' religious freedoms? Plus, how are Kansans doing at flattening the curve as we head into the peak of this pandemic? That's what we're talking about right now on Kansas Week.
Southwest National Bank has proudly served Wichita and its surrounding communities for over 100 years. We are happy to support KPTS, Public Television for Kansas.
Welcome to Kansas Week. I'm your host, Pilar Pedraza. In the last week, the number of coronavirus cases continued to increase in Kansas, though maybe not as rapidly as once feared. Now, according to the KDHE, 1,705 Kansans have now tested positive for the coronavirus infection. Of those, 375 have been hospitalized at some point and 84 have passed away. But if you look at the Reno County Health Department's website, we see a breakdown of the counties with the highest number of cases per capita. Take a look at this. Ford County right now has the third highest rate of infections per capita in the state. Last week, Ford County was at the bottom of the list.
We do have a number of new patients out in western Kansas. We're sending 2 of our testing platforms out there today with people to do the contact tracing, working with the counties there. We'll have a lot more after they've actually gone in and done their investigations.
A lot of speculation going on right now as to the cause of that. One of the many things we're going to dive into in this episode and what it all means for Kansans' daily lives and when we may start to get back to normal, whatever that may be in the long term. I'm joined here on the desk by Diane Leffler with the Wichita Eagle and Adam Strunk, editor of the Newton Now. And joining us by phone, we have a special guest, Governor Laura Kelly. Welcome.
Hey, it's good to be with you.
All right, so we're going to start off. We've all got a few questions for you, but I'm going to start off asking them kind of the biggest one. We're hearing so much about these different numbers, and yet you've said you rely on the advice of scientists when it comes time to come back to normal. What are you hearing from those scientists right now?
Well, the conversations that I'm having is, as you all know, we just extended the stay-home order statewide for another couple of weeks. It'll take us out to May 3rd. In the meantime, what we're doing is we're meeting with our public health people, our emergency management people, and then people from various sectors of the state and the industries, and we are putting together a strategic plan that will allow for a gradual reopening of our economy. And I want to say up front that if public health concerns are such that we have to extend it beyond May 3rd, we will do that. But I'm optimistic that that May 3rd deadline will allow us to at least start reopening some of our economy regionally. You know, I mean, as you look at the map of Kansas, you can see that we have, harder hit areas in a number of regions. So we would lift the statewide stay-home order, begin with a lot of guidance that we'll provide to certain regions of the state to allow them to start to open up. In the meantime, we would give back to the local units of government their authority to issue orders should they think it necessary. If they think it's too soon for them to open up, they can put back in place an extension.
And I know we've been hearing a lot from viewers and readers about the extended stay. A lot of folks just really want it over as soon as possible. I'm assuming you're hearing the same thing, Diane, Adam?
Well, yeah. I mean, I think we've all been inside enough.
Yeah, we're all a little stir crazy. Governor, if I might ask, kind of playing off of that, something that I've gotten from my readers a lot, there's a group of them that wondered at the decision to extend the stay-at-home order to May 5th or May 4th. Can you kind of explain for folks the justification of extending that stay-at-home order as you did recently?
Right. Well, you issue the first one based upon the numbers, and what you're seeing. And if you recall, a number of local units put in stay-home orders. In Johnson County, Wyandotte County, I believe Sedgwick, and Shawnee County. And I waited until it was clear that these cases were starting to spread beyond our major urban areas and into our more rural areas, and then saw the need to go ahead and get rid of the patchwork and just create a statewide order. That was based on the numbers that we were seeing, the positive cases that we were identifying, and the hospitalizations. We will use that same metric as we look at lifting the orders. So, we're following. We've got epidemiologists, sort of tracking where things are going, and we expect that we're going to hit our peak sometime in late April, and that we should then start flattening out and then hopefully coming back down. So, if that remains the case, then I'm very comfortable with lifting the statewide order, leaving it to the locals if they think they need to extend for their areas, but then starting the gradual reopening in some of the areas that are seeing fewer cases and don't have the social distancing issues as much as some of our more populated areas.
Governor Kelly, you've talked about a couple of times here a gradual reopening. How gradual? What are we looking at? Are we looking at weeks? Are we looking at months? Are we looking at possibly even a year or more?
Well, let me also say the most important thing we have to have in place by May 3rd is a much more robust testing and contact tracing process. I think that Kansas has the lowest per capita testing rate in the country, and that's got to change. And the reason it's there is that we've just had a very hard time getting the testing materials that we have needed. We are working very hard. I've got a conversation tomorrow with a representative from the White House to go through a very detailed laundry list of what it is we need and when we need it. But we're also working with the private sector to do everything we can to make sure that we've got enough testing available to allow us to safely open up. In terms of when can we open wide, I'll be very honest with you, and it's not anything anybody wants to hear, but it is the truth. Until there is a proven safe vaccine that is manufactured and distributed and then used, it will be very difficult to go back to the normal as we knew it 6 weeks ago.
All right. Well, we're going to talk a little bit more about testing in a little bit here. But before we get to that, we do want to discuss a lawsuit. Two churches who've been outspoken about their belief that the state's 10-person limit on group gatherings can't apply to them have now sued the state in federal court. Let's take a look. Pastor Stephen Ormerd with the First Baptist Church in Dodge City and Pastor Aaron Harris of Calvary Baptist Church in Junction City are asking a federal court to overrule part of the governor's executive order 2018, the part limiting church gatherings to fewer than 10 people. They argue the order violates the First Amendment as well as the Kansas Preservation of Religious Freedom Act. Harris was one of at least 2 Kansas pastors to hold services on Easter Sunday despite the order. The governor had originally exempted churches and religious services from that 10-person limit on group gatherings, but changed course after state epidemiologists linked several COVID-19 outbreaks in the state to church services. Republicans on the Legislative Coordinating Council tried to overturn the order, but the state Supreme Court ruled only the full legislature could do that. An attorney for the Alliance Defending Freedom said the government is right to protect people's health and safety, but again, they have to do it even-handedly, and they have to do it in accordance with the Constitution. There is no one-size-fits-all order, but that's exactly what the governor has done here, has prohibited all church services, no matter the size and no matter whether they're actually putting in place social distancing measures. And this lawsuit was filed Thursday, so I know, Governor, you've had at least a day or so to take a look at this. What is your response to the lawsuit at this point?
Well, as was mentioned, when we put out our first stay-home order, we did exempt churches, unlike 40 other states that issued stay-home orders, and churches were included in that. So we lifted the exemption for churches when we were experiencing all those clusters. I think we're up to 9 clusters now in church settings, and at least 6 deaths. So it became clear that it was a public health issue and that we needed to put the same mass gathering limitations on the church facilities as we had for practically every other facility in the state. It was in no way an attempt to limit one's ability to practice their religion. In fact, most of our faith community had already gone to sort of virtual mass or virtual service or drive-in service, so they had already taken it upon themselves. There were just some that had not. We had clusters from that, and so we decided to make it statewide. We will see. I'm very comfortable with the decision to do that. They still can have services in person as long as there are 10 or fewer people, not counting the people doing the service, and socially distanced. That is still acceptable, as are obviously the virtual and the drive-up services.
Governor, with kind of this decision, I also received some feedback from readers talking about the fairness of applications. Some of them have noted that almost everybody and their dog seems to be working in an exempt industry. Some of these industries are employing hundreds of people in the same building, or people see each other going into the grocery store in larger numbers. And I've had questions of why would we apply this rule only to churches and not some of these larger employers or places that we shop, limiting the numbers. Could you speak or answer some of those questions or that question?
Yeah, well, first of all, it is not only churches. There are a host of other facilities that have that same limitation. There are some that don't, and grocery stores being, for instance, one of them. But even what you've seen there is now, them limiting the number of folks who can come in at any one time, setting up lines, keeping people apart. So they're implementing the same public health guidelines to ensure that people coming to shop in their stores are not getting sick. People have to have access, though, to groceries. I mean, that's just, they can't live without it.
Thank you.
Governor, we had that extraordinary Supreme Court hearing on Saturday, and you won that, but you won it on the narrowest of grounds that the resolution that the legislature wrote had just been miswritten, for example. Will we be headed back to the state Supreme Court to hear some of the broader legal questions on this?
I can't answer that because I really just don't know. I'm hoping that we can come up with a solution that doesn't require that, however.
Okay. Well, and you've talked a lot about how we need some more broad-based testing to reopen the state. And I know that some areas of the state are starting to expand their testing. The state is not, the big problem with reopening in the state is not knowing who has the virus, but not the symptoms, those who are asymptomatic. And Kelly has said that Kansas is dead last when it comes to the testing rate. So KAKE's Eli Higgins shows us what some counties in the state are doing about that.
Kansas Governor Laura Kelly made the awkward announcement to the country on CNN.
I'm a little embarrassed to tell you that Kansas ranks 50th in per capita testing. We have had a very difficult time getting access to tests and all of the stuff you need to complete those tests. So that was part of the conversation I had with the White House.
Data released by the Reno County Health Department shows Kansas is testing only 495 people per 100,000 for the virus, last in the country. It's something the governor says she discussed with President Trump and other state leaders Thursday in a conference call. But hopefully, those numbers will soon change.
The great news is that KDHE, their state lab, Cahill, they've loosened up the criteria.
Until now, Sedgwick County, which accounts for more than 500,000 residents, was only allowed to test people over the age of 60 with pre-existing conditions or anyone with a compromised immune system. But under the new guidelines from KDHE, the county can now test anyone who has a fever and just one other related symptom, like cough, congestion, or body aches, which has already dramatically increased the testing rate.
It's been really frustrating, and I'm sure very, very frustrating for the community as well, that they've been ill and they've been turned down to be tested.
The governor believes her conversation with the White House was positive. Now, she says the state is working on a new plan of attack.
I'm going to be taking all of this information and putting it together in a way that makes sense for Kansas.
So, Governor, I'm going to start off with, what did you mean by the conversation with the White House was positive? What can we expect out of that?
Well, what I meant by that is, on the conversation, and this includes all 50 governors, the vice president, the president, and then Anthony Fauci and Dr. Birx, and a couple of other people. And I brought up the issue of the fact that we really are not getting the tests that we need available here, and that everything has been sort of punted to the private market, and so it's very difficult for Kansas to compete in that with the New Yorks and the Illinois and the Floridas and Texas. So it's hard for us to be at the top of the chain for the private suppliers too. So I brought all of that stuff up when I was on the phone. And I made a point, particularly, of the fact that Kansas is an agricultural state, and so we feed the nation, and that it's very important that we're able to keep our meatpacking plants, processing plants alive and working, so that we can get that food out to folks. And that, in order to do that safely, we need the testing and we need the personal protection equipment. So, from that, I got a follow-up call from the admiral from who's the logistics chair with the Joint Chiefs of Staff, and so I will be having a conversation with him tomorrow morning, and we're going to go over what Kansas needs and when we need it. And I'm hoping the fact that they reached out after the call gave me confidence that they heard me. They understand, and that they're going to do what they can to remedy this situation here in Kansas.
Governor, do you think we're going to be able to get to the point soon where we go beyond medical diagnostic testing and get into community surveillance testing? I'm told by the health professionals that I talk to that that's a very important aspect of trying to track this thing. To be able to do some random testing out in the community of people who may not be symptomatic, just to try to get a handle on that. And one other thing too, I heard a very chilling statistic today when I was working at the city council, and that homeless people in Kansas will be, if they follow the trends that we've seen in California and Washington, the homeless will. Their infection rate is going to be twice what it is for the general public. I wonder if you could talk to those two things.
Yeah, if not more so. In terms of the sort of the community testing, population testing, we're actually beginning that in Kansas right now. In fact, I think Finney County, Ford County. I believe there's been some in Sedgwick County. No, Johnson County has done some in the past couple of days. So we are starting to do that. And part of the reason that we're able to do that is we did come up with our own solution on the swabs. It's great to have the testing kit, but if you don't have the swab to collect the sample, the kits do you no good. So our Secretary of Health and Environment came up with an innovative way to get this thing done. As it turns out, dentist offices often have 3D printers that can actually make these swabs. They're not like Q-tips at all. They have to be all synthetic. And these 3D printers in the dentist's office can actually do this. So we started working with our dentists around town, around the state, and they are manufacturing a number of these for us. KU is going to really ratchet it up through their programs. And so that just the availability of those swabs has allowed us to now go do this community testing, and this is of asymptomatic people. It's just random. And you're right, we absolutely have to have that kind of testing going on so that we have some idea of where this virus is and at what level in various parts of the state. So, yeah, that's critical, particularly as we're looking at reopening the economy.
Governor Kelly, I noticed you mentioned Johnson and Sedgwick County. Dr. Norman, in some of his press conferences, has talked about additional platforms coming into the state that it might send to various larger hospitals. And you talked about how the state is testing at a very low per capita number. Rural counties are testing in a lot of cases even lower than the state average. What ideas or action is the administration taking to ensure Kansans in rural areas, maybe away from one of those larger hospitals, have access to testing as well?
Well, yeah, as I just told you, we are doing some of the testing now in Finney County and Ford County. So we are moving into some of our more rural areas. And, we will make the testing available as we have the test kits available to do. We have had to take sort of a triage approach to who we could test just based on the fact that we didn't have a lot. As we get more, we can open that up. We can go from, at one point, we were only testing people who were clearly sick, and they would get tested. Now we've been able to expand that somewhat to people with, symptoms. Now we're going to be expanding it to sort of the community testing. So as those tests are available, we will use them, and that will include moving into our rural communities. They should in no way feel like they are forgotten. It's just as you look at where the clusters are, where the numbers are, that's where the tests have had to go when there hasn't been sufficient number.
Well, as we've waited for these tests to come in over the last month, it's led to a lot of unemployment as folks have had to stay home. In fact, an exponential growth in unemployment over the last 4 weeks, overwhelming the Department of Labor's computer system until it essentially completely shut down last weekend. Now, the department is unveiling an upgraded web page, a new format for filing claims, and promises of additional federal aid coming as soon as next week. Alec Gartner from KSN's Capitol Bureau breaks it down for us.
The state's labor secretary says the department is hiring more people, and a new process is being put in place to make sure everyone can file a claim. Secretary Delia Garcia announced a new method of filing, assigning people to file a claim on a specific day based on their last name. Names beginning with A through M can file on Sundays, Tuesdays, and Thursdays, while N through Z should file Monday, Wednesday, and Friday. Saturday will be available for anyone to file.
There is no disadvantage to you if your last name is Zook, for example, and you file on Monday instead of Sunday. By participating in our gating program, you will help to ensure that all Kansans are eligible for unemployment insurance benefits and will also have access to the system.
Many people, especially self-employed Kansans, are wondering what they have to do to get money that was passed by Congress in the CARES Act. She says that money will be back paid from when the bill was initially passed. She also points out if you're self-employed, you must be denied first before you can apply again to collect benefits when the money is available.
Go ahead and file a claim, and then you would have that proof of denial that will get you through. You do not have to do anything extra or additional because we will have you in our system.
Officials say they hope to have the $600 a week in federal funding going out to Kansans next week. Reporting at the Capitol, I'm Alec Gartner.
And I think probably the biggest question a lot of folks have had that I've been hearing from, well, two of them really. How did the system get this old and problematical for a situation like this? And also, why did it take so long to get to the point of saying, hopefully we'll have that extra federal funding to you next week?
Let me first question: how did we get it to be this antiquated and this dysfunctional? Actually, back when I was in the state senate, we did appropriate funding. I think it was up to $47 million was set aside to modernize the system, and that was begun. And then in 2011, the modernization was just stopped dead in its tracks. All the vendor contracts and whatever else were just ceased, and then they went forward just with what they had. So they never completed the modernization project back as far as 2011. So that's how we got here, is that we did not invest the time and the money and the expertise in getting us to the kind of system that would have worked better. I'm not going to pretend that any unemployment system that we could have had in place would have been able to handle the volume, but it would have been a whole lot better. What we've done since, actually, Secretary Garcia, one of her first acts coming in as secretary was to begin the modernization project again. And she spent the entire last year working on all of that. Those things are very complex, way over my head. They're very complex, and they take a lot of working together and partnering and integrating. And so they were working on that, and then this hit, and they had to just stop working on that just to deal with the issues that we've got facing us today. So that's how we got there. In the meantime, what that department has done in concert with our Office of Information Technology Services, Secretary Burns Wallace over there, is that they have brought in experts in. We're still working on a COBOL system, which is a 40-year-old system. So there are very few people actually know how to engineer those. We brought experts in that area into Kansas to help us patch together what we've got right now.
Governor, I am so sorry to have to interrupt you, but we are out of time. I appreciate you so much taking out the time to speak with us today. Hopefully this has answered some of the public's questions. We hope to see you again on the show, preferably here in studio once things get back to normal. Diane, Adam, thank you as well for joining me today. For now, I hope our discussion has been enlightening, and I hope you have a great week.
Southwest National Bank has proudly served Wichita and its surrounding communities for over 100 years. We are happy to support KPTS, Public Television for Kansas.